So here we are again, and we're talking about blood work and other diagnostic tests when you have systemic lupus erythematosus. We've been through some blood tests, some basic information, some x-rays you may have to have. I want to encourage everybody. Some people get really scared when they go to the doctor, even to get their blood taken, and they get kind of feeling sick and stuff like that. But if you feel sick and they think you need to get tested for different stuff, then you need to really have courage and get these tests done. If you put them off and wait and just deal with the pain or whatever and keep waiting, you could die. And I want to stress that lupus is an illness that you can die from. People don't want to talk about that. They don't want to recognize that. They don't think it's a big deal, but you can die from it. And that's why it's really important to get your tests done and to follow your doctor's instructions. There's a lot of people that when I tell them I have lupus, they suggest 1,000 different alternative medicines. I cannot fool around and be taking, some kind of weird treatment that has no scientific backing. I'm risking and playing with my life. And this is why I do take natural medicines, but I'm not willing to not listen to my doctor and not take the medicines I need to take. I've tried not taking them, and it's a mistake. Your body gets out of control, and then that's it. You end up in the hospital, and I'm the one that's going to have to lay there and suffer. So if you suggest alternative treatments to me, I'm thankful for your concern, and I really, but I have to listen to my doctor. Another thing that you may get when you have lupus are bunches of papers with all kinds of diagnoses on them. Different blood work, different diagnoses. What happens is when you have lupus, um, there's different illnesses that pop up in conjunction with the lupus. For example, I had pericarditis. This is the swelling of the membrane around the heart. Pleurisy, that's the swelling of the membrane around your lungs, which causes pneumonia. There's also the skin involvements, which with me are not too bad right now, but they're there. Also, you can have different kidney illnesses, high blood pressure. If your kidneys get sick, you can get high blood pressure. There's heart involvement. You can get heart problems. There's also something called Raynaud's syndrome. Raynaud's syndrome is a something to do with the blood vessels and the blood reaching the extremities in your body. And what happens is at temperatures, just normal temperatures like 60 degrees, 65 degrees, 70 degrees, at these temperatures, my extremities will start to turn blue and the blood will not circulate in them. This doesn't come from the heart. This comes from small blood vessels in the extremities. They spasm, restricting the blood flow. My lips will get blue, and you're cold. Then when you start to warm up, they turn white, they turn red, and it looks pretty scary and nasty. But this is hard to deal with because you can't go out on a cold day without freezing, and your extremities will actually get numb. So that's hard to deal with. That's one of the diagnoses that you can have. Other things that can happen are, arthritic diagnoses where certain joints are swollen and out of control. It can affect your central nervous system, which is a problem that I have. I get diagnosed epilepsy induced from the lupus. They're not too sure why that happens, but it does. Other neurological effects like Turner syndrome, which is when your eye starts to swell, your face hangs, palsy. There's all kinds of things that can happen when you have lupus. So don't be scared of those diagnoses when you read them. If you don't understand the words there, then ask your doctor to explain them in simple English for you or whatever language you speak. Don't be afraid to really speak up and ask because they understand and they can explain that to you much better than I can. But if you do have questions, don't hesitate to ask me.